Accidents happen when you least expect them. And when they do, you head to the ER. Your plan? Get in, get treated, and go home. So why can it take so long to just get past the waiting room? One reason is sheer numbers. Every day, about 500 people come to community medical centers' ERs. A few by helicopter, about 200 by ambulance, and the rest through our waiting room doors. ERs can't operate on a first-come, first-served basis. The sickest people have to be treated first. And people with life-threatening conditions get treated immediately. We've found a lot of people in the San Joaquin Valley don't have a primary care doctor or insurance, and they use the ER like someone would a doctor's office to treat earaches, coughs, or fever. Illnesses like these can make a person feel pretty bad, but they're typically not life-threatening, so these people often have to wait. Using the ER like a doctor's office is expensive and causes a problem for those who need emergency care, because it overloads an already crowded system. Another reason ER waiting rooms are so packed has to do with the number of hospital rooms in the valley. Most people expect to go home after being treated in the ER, but not all of them do. Some will need a hospital room. So at the same time our ER is busy, other areas of the hospital are too. Delivering babies, performing scheduled surgeries, and taking care of people who've come through the ER days before. If there aren't any hospital rooms available, then patients who come in through the ER have to stay there until someone is well enough to go home. This ties up the ER staff, sometimes for days, and the waiting room becomes even more crowded. Now that you understand why the ER can become backed up, what is Community Medical Centers doing about it? We've set up 4 stations for evaluations and treatments, and most patients see a practitioner within minutes of walking through our doors. Station 1 is for assessments. Patients then work their way through the other stations as needed. Station 2 is for quick things like lab tests and x-rays. Station 3 is for exams and minor medical procedures. Station 4 is for things that take more time, like starting an IV to treat dehydration. If the problem can be resolved at one of these stations, the patient is treated and sent home without having to wait for treatment areas reserved for more serious emergencies. Another thing we've done to relieve crowding in the ER is open a prompt care clinic to help care for routine things like fevers, aches, and pains that aren't an emergency. And we're developing new programs to help people with chronic problems like diabetes, asthma, and mental illness who find themselves in the ER over and over when their conditions aren't kept in check. But the biggest thing we are doing is expanding our hospitals because, truth is, there aren't enough hospital rooms in the valley to meet the needs of the people who live here. It takes years and lots of money, but we've opened more than 100 new beds over the last 5 years alone. We've just shown you 4 things we are doing to ease ER crowding and decrease wait times. Now here are 4 things you can do. Be safe. Find a primary care physician who can spot problems before they become emergencies. Take care of yourself. Follow your doctor's advice. Consider alternatives. An urgent care or prompt care clinic might be faster for treating non-emergencies. When the worst happens, it's no fun to be in the ER. But when you need us, we'll be ready